ideologically, philosophically consistent. Free market. Government's not going to make you, not mandate it. You're going to have options out there. But if you choose not to get health insurance, that's where that number goes way up.
And that's a fine argument to make, but the problem is you do need to have a certain number of people in the marketplace. And so the Democratic position was to require them to do so. Republicans are arguing that the sheer cost and accessibility will draw people in. But there's a lot of skepticism around that, particularly for younger, healthy people, which have been actually a hard group to get into the Obamacare system, even with the mandate. So without that pressure on how will you compel those people to buy a plan, that is a huge unanswered question. And without answering that question, a lot of these other factors that Ryan is talking about are just much less certain.
And access doesn't mean affordable. Right. That's the other thing. I mean, people might drop off because they can't afford what they're going to have to pay under this new plan. And that's a big problem for Republicans if these people are ending up using the emergency room again as their main source of health care.
Yeah, and this idea that health insurance companies are going to compete to take care of poor people who are very sick, who might have heart disease or diabetes, it's very expensive. And I think people have experiences with the healthcare industry already, and insurance, and having their doctors be on the phone argue for for care and not getting that care. So this idea that that's all of a sudden everything's going to be great and the health insurance market is all going to be wonderful, I think it's a really hard sell for the GOP to make.
Right. And this, I think, is where the president comes in. He has shown a willingness to reach out directly to individual businesses. Is he going to be willing to reach out to insurance company CEOs and said, be more competitive in these rural areas? One thing that has been stunning to me over this...
pass the bill first.
Well, exactly. That's true. But one thing that's been so interesting over the course of this long healthcare debate, insurance company CEOs have largely remained in the shadows, and there haven't been people running after them in the streets with pitchforks and other things. Sort of like the bankers and other things back in the fiscal crisis. I think if he uses the power of his bully pulpit to call out insurance companies to get more competition, that's one thing. But you're right. You have to pass the bill first, which is harder than signing one of those executive orders.
And I just showed the premium increase for older voters. They are the most politically active. They're the most reliable come election day. They supported Donald Trump in majorities, his largest group of support in the electorate. Listen to his budget director right here, asked this morning, is the president or does this plan essentially pull the rug out from under some of his most loyal voters?
We're not pulling the rug out from anybody. You've heard us say that again and again and again. The bill is specifically tailored to do that. And to everybody else who's had an insurance card under Obamacare and looked at that deductible when they got sick and said, you know what, I just can't afford to go to the doctor, I can look you in the eye and say things are going to be better when this bill passes and becomes
even for
law.
those elderly that the CBO score has them hitting at about $14,000 deductibles.
Because, again, they've got programs now that they can't get to the doctor with. Again, you're talking about coverage. I'm talking about care. That's the fundamental disconnect here.
I mean, I think there is a larger question of whether or not Mick Mulvaney and Tom Price are the right salesmen for this, and Paul Ryan. I think sometimes Mick Mulvaney comes off as a sort of a little glib, a little jokey at times, certainly on our air this morning. Tom Price comes off as a little bit of a CEO. He's a surgeon. He doesn't necessarily have the bedside manner of a primary care doctor. And then Paul Ryan, sure, he's going to take off his jacket and have the charts and the graphs there. But I think they've got to work on this. I mean, there's not a lot of empathy. There's just like, trust me, this is going to be great. And again, this is coming from the White House, who has had a problem in terms of being truthful with any number of things.
Is part of that their skill set or lack thereof, or is part of that they're trying to do an inside Washington game right now, which again, we're talking about, getting votes, twisting arms, reconciliation, budget scores, not John and Jane Doe out there, this is what it's going to do to you, or this, your employer may stop providing you health care. It's a very different debate in this town and the language than it is out in America.
I think that's absolutely true. And they've not done the hard work of bringing on all these outside groups, the doctors groups, AARP, other things. Really, if you look at all of them, almost all of these major groups are opposed to this. So what is the White House going to do to sway them, convince them? This CBO report makes it incredibly difficult.
Another tough part of the sales pitch is the Democrats are hitting on the fact that this bill gives tax cuts, tax benefits to a lot of wealthy people. Again, listen to the budget director saying, so what?
We promised at the very outset we were going to repeal all of the taxes. Who cares if somebody else benefits? Why do you have to have a system that punishes somebody in order to help somebody else? We think we've created a system that saves money and allows more people to get affordable health care. why would it be bad if folks benefit from a small tax reduction at the same time?
That gets back to Nia's point about the salesmanship.
Yes.
and
Absolutely.
What to say and maybe what not to say.
And it gets back to the people who voted for Donald Trump, who are, by and large, working class voters who responded to the financial crisis and a lot of the benefits for wealthy Americans by turning toward
And who
Trump.
believe the system is rigged.
and who believe the system is rigged.
This is a child alert. If you have a child in the room, put your hand over your ears right now. This is in the Bloomberg article quoting this, a Trump supporter who doesn't like these tax cuts. Quote, "It pisses me off, but my wife pisses me off too, and we're still married." That was Dan in Wisconsin. I won't say Dan's last name in case the wife